Hi everyone, my name is Shariff. I come from Kakamega, so whereby I was taken by my aunt after my parents deceased. So I was brought up in a family of 6 people, and it was a very loving family, and they were supportive in my sense, in the sense that coming from a different family, they took me in as their own. With my family, we were born 2 of us, my brother and I, who actually stayed in Nairobi until October 2021, when he actually passed on. I joined the program. We were the first pioneers of the program because I joined the program in the year 2002 via a different model of care in comparison to what is happening now. It was called a feeding program, whereby we would come over for lunch, for a plate of a meal, and then we'll get back to school. And then in August, we'll have something that we were really anticipating for. It was actually called a summer camp, of which we'll have our sponsors coming all the way from the US. And then we'll have here 1 to 2 weeks of activities doing tie and dyeing, and then get to town to buy a book, and then also go swimming. I joined as a student for feeding program up to class 8, and then when I did my KCPE exams, I passed well, so I was given a continuation of the scholarship, and I got to high school, where I went to St. Paul's High School, Lubinu. I finished my studies there and actually got a B+ of 70 points. And then I joined university to do nursing, and which went well, and I graduated with 2 programs instead. So a bachelor's degree in nursing and also something else in development studies. So after that, I was called by the Ministry of Health to do my internship at Embu Level 5 Teaching and Referral Hospital. While I was there, I actually saw a need of how the care was being given to the community, the struggles that they are going through, and I wanted to be an impact of change. So that actually inspired me to get into graduate school. So where I joined the University of Nairobi, I am doing health economics and policy. So I've actually finished the program, the exams last month. They were very tough. So currently I am working on my thesis and dissertation. So my area of focus is breast cancer, because it's something that is actually upcoming in the country. And we have very scarce researchers on it. We don't have people who have specialized in it very well. And I'm coming from the policy level. So that's where my research is actually based, to understand the economic impact of breast cancer in Kenya, focusing on finance. So first of all, it was the psychological support which is there, and then there was the paying of the school fees, which is also very a package of it. And then we would have some forums whereby we would come for mentorship, and then also Miss Grace will actually go ahead and visit us in school, and then to see how our performances are. So I'll just say the care is actually holistic, on the basis that they do not just focus on your education, because they also want to instill sustainability, because I think it's also a vision for them to help you get nurtured and then be self-sustainable. So I'll just say the care is actually holistic in terms of like healthcare, in terms of education and other support, on the basis of the programs that are actually coming up. I am a vocalist, and apart from that, I am involved with various associations in Kenya. So I am involved with the National Nurses Association of Kenya, whereby I served as the Kenya Novice Nurse Representative, representing all 121 institutions of nursing. to the main office, whereby I even worked with the government to ensure that the interns are placed for their internship. And with my group, we were able to place close to 1,000 nurses interns. And then also I am part of the Health Economic Society of Kenya, whereby we meet up and we do some marvelous work, like reviewing the current social health insurance fund. We're also doing the same. Yeah. Few years to come. So that's a very good question. So first of all, I see myself being in Africa, because I'm a solid Pan-Africanist, because I believe we are the people who are supposed to come up with solutions in helping Africa, and my area of interest is actually healthcare. So secondly, I see myself to be still part of the organization, either in support in trying to bring up the healthcare department if they will require my expertise. I see myself as someone who's a game changer, on the basis that I was privileged to receive an education. So it is kind of my mandate to make sure that they are uplifted economically, and because my other ambition is based on sustainability. So it's a matter of like working with them, seeing what they actually need very much, not like what they want, and then enable them to come up with, if it's life projects, so that they may become sustainable financially and whatnot. I'd really want to say thank you so much, in the sense that having been selected amongst the many, and having gone through the hurdles, is actually a great impact in my life, and I'm just a living testimony on my end. And when I go out there carrying the name of United Kenya Rising in the forums, and being a proud alumnus of the whole organization and the program, is what is really impactful to me. And lastly, I'd like to say thank you to my sponsors, Alexa Bratt, Kara McFadden, and John McFadden.